Good morning, everybody. It's Dr. Hogan here at Allied Chiropractic Clinic. Today I wanted to talk to you all a little bit about how we treat, or one of the techniques we use to treat patients that have low back pain, whether it's a severe case and it's hard to walk and they've got sharp shooting pains down their legs, or just their constant aches and pains. This is a very gentle technique that we can use to help, one, alleviate some of that pain and pressure on the low back and help heal that as well. It's called the Cox flexion distraction technique. Like I said, it's a very gentle technique. There's no popping or snapping or laying you on your side like a lot of people have heard before. There's going to be a lot of pops and cracks. We're going to have you laying face down on the table. And what we're trying to do, one, is stretch the low back out. And I'm going to use my model here. So we're going to have you laying on the table like this, face down. Here's your front, here's the back. And we're going to try to, the low back, open up these disc spaces here. These are the discs, these are the vertebral bodies. And we're also going to try to open up these foramen here where the nerves come out. Now, granted, this is just a model spine. It's not real. But you have to understand there's a lot of muscles and ligaments and things around here. So when we're opening up these spaces, we're trying to relieve pressure on these nerves. We're also trying to open up these disc spaces, pumping the disc, and also stretch the paraspinal musculature in the low back to help relieve some tension and spasm in there. A lot of people don't realize that discs, that their primary function is for, or they think their primary function is for cushioning, and that's not the case. Their primary function is for movement, and that's something I can talk about later on. But the problem when there is a disc injury, when you cut yourself shaving, or you fall off your bike and you scrape your knee, you bleed, and then it clots and it heals. Well, discs don't have a blood supply, so they're not going to heal the same way that your skin would, or if you broke a bone and that's going to heal. So what we're going to try to do here, or what discs need, is a pumping action. To pump nutrients in, pump bad stuff out. They need motion to survive. And when I say that, we also need to be hydrated because discs have a lot of water in them. So also that the Cox flexion distraction technique will help pump the discs, help get motion in there where motion might not have been previously. We've had a lot of success with this technique. I would tell you probably 98% of the low back patients that we treat here in the office get this at some point in care, whether it's in the beginning, throughout the entire course of care, or primarily at the end. It's a very good technique, very low force, very gentle, and we get great results with it. If you have any questions, please feel free to give us a call here at Allied Chiropractic Clinic, 678-646-0401, or reach out to us via email, alliedchiro@bellsouth.net. And you can also check us out, check our website out at chiropracticnorcross.com. Thanks and have a great day.